for a solid family health plan. Good network, low deductible, no complaints whatsoever. Today, that exact same family is paying over $900 a month. Same provider, same basic coverage, nearly double the price for what looks like the same product. Nothing about Sarah's health changed. Nobody in her household got sick. Her husband didn't change jobs. So what, exactly, changed? Here's where this gets uncomfortable. Hospitals and providers have been quietly raising the prices they charge insurance companies for years, often buried deep inside private negotiations that ordinary policyholders never see and never get to question. Insurance companies then turn around and pass that rising cost straight onto you, dressed up politely as a premium adjustment, as if it were just routine paperwork instead of a direct hit to your monthly budget. Now stack on top of that the relentless rise in prescription drug prices, an aging population that statistically needs more frequent and more expensive care, and hospital networks merging into massive regional systems with almost zero local competition, left to keep prices in check. Put all of that together, and you get a perfect financial storm. A storm that drains your wallet every single month, whether you ever set foot inside a doctor's office or not. And here is the part that should genuinely concern you. This trend is not slowing down. Healthcare economists have been warning for years that premium growth is consistently and reliably outpacing wage growth, and the gap between the two keeps widening with almost every passing year. That means the version of this problem you are feeling right now, today, is the smallest version of it you will ever experience. It only gets heavier from here, unless you actually understand how to navigate it intelligently. And the families who assume it will probably level off soon are usually the ones who get caught most off guard, because the data simply doesn't support that kind of optimism. Now think for a moment about what this slowly does to a normal household budget. If healthcare costs keep quietly eating 5, 6, sometimes 10% more of your income every single year, something else inevitably has to give. Retirement contributions shrink. Emergency funds get thinner and thinner. Family vacations get canceled or postponed indefinitely. Long-term dreams get pushed further and further down the road. This is not simply a healthcare story. This is a financial survival story, playing out quietly in the background of millions of lives. And the unsettling part is, most people don't even realize they're in the moan, already losing this fight until the bill is sitting right in front of them, already due. There's another layer to this that rarely gets discussed openly. Many employers, facing their own rising healthcare costs, quietly shift more of that burden onto employees year after year, whether through higher payroll deductions, narrower provider networks, or upgraded plans that actually cover less than the plan they replaced. Most workers never compare their new plan documents line by line against last year's plan, so this shift goes almost completely unnoticed until someone actually needs care and discovers their favorite doctor is suddenly out of network, or their usual prescription now costs triple what it used to. It's a slow leak, not a single dramatic event, and slow leaks are exactly the kind of financial damage that's a leak ogre used to, and say, nadirade, in the large samages. And here's a scenario worth sitting with for a moment. Imagine a single unexpected diagnosis. Nothing rare, nothing exotic, just an ordinary, common condition that millions of Americans manage every year. Suddenly, you're not just paying your monthly premium anymore. You're paying your deductible in full, then a percentage of every visit, every test, every prescription refill, on top of a premium that was already eating a growing share of your paycheck before any of this even happened. For families living paycheck to paycheck, that single diagnosis can be the difference between staying financially stable and falling into medical debt that takes years to climb out of. This is exactly why understanding your plan before you need it matters so much more than understanding it after. So if premiums are rising faster than salaries practically everywhere across the country, are you simply stuck watching it happen? Is there truly nothing you can do except sit back and watch your hard-earned paycheck disappear into deductibles, copays, and rising monthly premiums? Actually, no. There is a real way to fight back against this, and it starts with understanding something that the overwhelming majority of policyholders never bother to learn, often for their entire lives. The very first thing you need to understand is this. Not every dollar in your premium is created equal. A surprisingly large chunk of what you pay every month isn't led to the A, and so the non-side is. It's going toward administrative overhead, hidden drug markups, and provider negotiations you have zero visibility into as an everyday consumer. Once you truly understand that, you stop asking the passive question, why is insurance so expensive? And you start asking the far smarter, far more useful question, how do I make sure every single dollar I spend is actually working to protect me? Here is your first practical move. Stop treating your health plan like a set it and forget it subscription you never think twice about. Every single year, during open enrollment, insurance companies quietly adjust premiums, provider networks, and deductible structures behind the scenes. Most people simply let their plan auto-renew year after year, without ever comparing it against anything else on the market. That one simple habit, actively comparing your plan year over year, instead of passively accepting the renewal, can genuinely save a family hundreds, sometimes even thousands of dollars annually. Think of your health plan like a subscription you forgot you were paying for. The insurance company is quietly counting on your inertia and your busy schedule. Don't hand them that advantage for free. Second, you need to understand the real underlying math behind your plan, not just the sticker price. A lower monthly premium paired with a sky-high deductible can actually cost your family more in a bad year than a slightly higher premium paired with a much lower deductible. Sit down and run the actual numbers based on how often your specific family genuinely uses healthcare services throughout the year. If you're young, generally healthy, and you rarely visit a doctor, a high-deductible plan, paired with a tax-advantaged health savings account, can be a genuinely smart financial move. But if you or a family member manage ongoing prescriptions or a chronic condition, paying a bit more every month for dramatically lower out-of-pocket costs almost always wins out over a full year. Third, and this is the step almost nobody actually takes, pick up the phone and call your providers and your insurance company directly and simply ask better questions. Ask if a specific procedure can be billed under a different, less expensive code. Ask if there's a generic, equally effective alternative to your current prescription. Ask your insurer directly if there's a negotiated rate available that you ran and not currently receiving. Hospitals and insurance companies are negotiating prices constantly behind closed doors, and as the patient, you have far more leverage in that conversation than most people realize. But only if you actually ask, instead of silently accepting the very first number that appears on your bill. Fourth, build what I personally call a dedicated healthcare buffer fund, kept completely separate from your regular emergency fund. Even setting aside $50 or $100 a month specifically earmarked for medical costs means that when a surprise bill eventually arrives, and it eventually will, it doesn't completely derail your entire financial plan for the month or the year. This isn't about trying to avoid insurance altogether. It's about no longer depending on insurance to absorb absolutely everything for you. And finally, start treating preventive care as genuine financial protection, not merely health protection. Annual checkups, routine screenings, and early medical interventions are almost always covered at little to no extra cost under most modern plans. And catching a problem early is consistently, dramatically cheaper than treating that same problem later, after it's become a full-blown emergency. The single healthiest financial decision you make this entire year might simply be finally booking that checkup appointment you've been quietly putting off for months. None of these 5 steps require you to become a financial expert overnight, and none of them require a law degree to understand your policy. They simply require you to become intentional instead of passive about a cost that's about already consuming a growing slice of your income every year. The entire system is quietly built around the assumption that most people will simply absorb rising costs without ever questioning them. The very moment you start questioning it, comparing plans, calculating real numbers, and asking the right questions out loud, you take back a measure of control that the system was counting on you never bothering to use. There's one more habit worth building, and it might be the simplest of them all. Read your explanation of benefits statement every single time one arrives, instead of letting it sit unopened in a drawer or an inbox folder. That single document tells you exactly what was billed, what your insurance actually paid, and what you're being asked to cover. Billing errors are far more common than most people assume, And a 5-minute review can catch a mistake before it becomes a debt collector's phone call. Multiply that habit across every visit, every prescription, every test, for an entire year, and you start to see a clear, accurate picture of where your healthcare dollars are truly going instead of guessing. Put all of these habits together and something interesting happens. You stop being a passive payer who simply accepts whatever number appears on a screen, and you become an active manager of one of the largest expenses in your entire household budget. That shift alone, even before any of the dollar savings show up, changes the entire relationship you have with your own healthcare costs. It's also worth remembering that you're not navigating this alone, even though it often feels that way at 2 a.m. staring at a bill. Many states have consumer assistance programs specifically designed to help people understand confusing charges or appeal denied claims. Nonprofit patient advocacy groups exist solely to help families negotiate medical bills, down to fairer amounts. Most people never call these resources, simply because they don't know they exist. Knowing they're out there, sitting in your back pocket for the day you actually need them, is itself a form of financial protection. Here's the honest truth sitting underneath everything we just covered. Health insurance costs are not going to magically slow down on their own, and quietly waiting for them to become affordable again someday is not a real financial strategy. But now you actually understand exactly why this is happening behind the scenes. And more importantly, you know precisely what to do about it starting today. Compare your plan every single year instead of auto-renewing blindly. Understand your real numbers instead of just the sticker price. Ask the uncomfortable questions almost nobody else bothers to ask. Build your own healthcare buffer fund. Read every statement that lands in your inbox. And treat prevention as your strongest financial shield against the future. None of this means healthcare will suddenly become cheap. It won't. But it does mean you stop being a passenger in your own financial story and start being the one steering it. Even inside a system that's stacked with hidden costs and confusing fine print. The families who come out ahead over the next decade won't necessarily be the ones who earn the most. They'll be the ones who paid attention while everyone else simply let their premiums auto-renew year after year without a second thought. If this video gave you a genuinely new way of looking at your own healthcare costs, do me a quick favor and hit that like button right now. It tells me you want more videos exactly like this one. And if you want to make absolutely sure you don't miss what's coming next, go ahead and subscribe right now. Because next week I'm in Skazer and breaking down the single most common health insurance mistake that's quietly costing American families thousands of dollars every single year. And most people don't even realize they're making it until it's far too late. Stay sharp with your money, stay sharp with your health, and I'll see you in the very next one.